This conference will
All
now
right.
be recorded.
So I'm Melissa Holland, the Executive Director of the Oklahoma Assisted Living Association, and happy to be here to teach you guys a little bit about assisted living. But one of the things I like to do a little bit before, I don't know if you've already had some of the other long-term care individuals here, but I do like to give you a little bit of a time frame or timeline and how assisted living came about, and then all the other options of long-term care, just for a little kind of history lesson before we get started. So long-term care options in Oklahoma. And this is one of the things that I use to teach legislators a little bit and also the public, because sometimes they get a lot of that kind of confused. And so we have our nursing homes, which what you guys are here to do is to become a nursing home administrator. And so that is a facility that provides that 24-hour skilled nursing care and is related services for residents who require medical or nursing care. And that happened, so the birthday of that in Oklahoma was October 1st in 1980 under the Nursing Home Care Act, and it's licensed by the Oklahoma State Department of Health. Currently, it requires a certificate of need. There is some legislation that is happening right now that is, I don't know if it will pass or not, but they're wanting it to no longer have that certificate of need. So we'll see how that goes through on this year's legislation. They do have options for Medicare and Medicaid. Then we have our residential care, and that is where you provide residential accommodations, food service and supportive assistance, and it may also provide assistance with your meals, dressing, bathing, other personal needs. But one thing to keep in mind with residential care is you're really not helping with the ADLs, you're just really providing reminders for ADLs. The biggest thing that in residential care, residents are really there to they need help with their medications and socialization pretty much. It began in November 1st of 1984, and it's under the Residential Care Act, and they again do not need that certificate of need. There are no options for Medicare as well or Medicaid. And right now, what you see mainly in residential care is you'll see individuals that are younger, and a lot of times they have a mental diagnosis where they need some mental health. Residential care also in their regulations, you have to be at least 18 years or older to be able to move into residential care. Then came the adult daycare center, and that provides your health, recreational, social, and supportive assistance to impaired adults for more than 4 hours per day. And these individuals do not stay the night. So it started in November 1st of 1989, and that was under the Adult Daycare Act. They're also licensed by the health department, and there is no certificate of need. They do have the Advantage Waiver Program, and that is your Medicaid option kind of through there, and that goes through the Department of Human Services. One other thing before I get going here too, they also have some respite type stays, and that can be done through, you have the veterans option that can come in there as well. And then next came the Assisted Living and Continuum Care Act, but assisted living, and that is a home or establishment that provides assistance with personal care, medication, ambulation, so pretty much all your ADLs. We do not provide 24-hour skilled nursing care. And the birthday of that is May 27th, 1997. And the Continuum Care and Assisted Living Care Act, we are licensed by the health department. We do not require that certificate of need. And there is no Medicare, Medicaid, but there is that Advantage waiver. And then we have the Continuum Care facilities. They're also licensed under the Continuum Care and Assisted Living Act, and they must also meet requirements applicable to nursing facilities, and then either the assisted living or the adult daycare center, so whichever they choose to have. This also, the birthday of that is the May 20th, 1997. And then there are options for the Medicare, Medicaid for that nursing home portion, and they do require that certificate of need for the nursing home portion. And then you have a little while back in 2013, the Veteran Centers actually came underneath the health department. And it was for the veterans or residents who are veterans living in the state veteran centers. And they're licensed as nursing facilities and related services required underneath that act. So that was May 29th of 2013. It does fall under the Nursing Home Care Act and they're licensed by the health department. However, any future veteran centers, they are not required to do a certificate of need. And then there are the independent senior living out there. And these are apartments and cottages and single family homes for seniors that are 55 or older and who do not require assistance with their ADLs, but it may be more convenient for them to live in senior-friendly surroundings with increased social opportunities. One of the nice things is that they do have their meals brought to them, and that's something that they do like. And they also don't have to worry about a home or all the upkeep for that. They are not licensed by the health department, but what we're seeing is they might have some high acuity that's receiving home health or hospice services. And quite frankly, some of the things that we have seen with assisted living is they may actually have residents that probably need to be in nursing homes from some of the acuity that we see in there. So let's talk a little bit about regulations versus rules. And this is one of the things that I like to educate our students about, because if you're kind of new to it, you hear people say like title this, title that, or is it a rule or regulations? And so I kind of like to educate you just a little bit about that so you understand a little bit more along the way. So what is a regulation? So that, and what is a rule? So regulations are laws. So that is what our legislators are doing right now. So they're the ones up there writing bills that will come into law. And those are what we have to follow. And sometimes it's also referred to an act in the law. It's usually brief and not defined in extensive detail. The rules we also have to follow as well. And so legislators usually in their law, they'll put that they'll promulgate the rules as an act. And so they'll say, like, say for OSBELCA, they'll say that in the OSBELCA Act or the regulation, they'll say that OSBELCA will promulgate rules that go with that act. And so that's why, because that's where the detail happens there. And typically regulation kind of trumps rules, but sometimes they're a little outdated, so it goes back and forth. So you have to kind of see where that's at, because there are some laws that are very outdated based off of some rules and things that have gone into, but they do need to update some of those things, and we're kind of working on some of that as well. So here's some important dates for assisted living. As I said earlier, May 20th of 97, that is the birthday of assisted living in Oklahoma. And this year we are celebrating 25 years. So we're pretty excited about that. We are going to do Assisted Living Day at the Capitol on March 15th. And at the end, I'm going to show you, I have a little invitation for you. We're going to go up to the Capitol and celebrate the 25 years, as well as, remind our legislators a little bit of the difference between assisted living. And then in June 25th in 1998, the Board of Health adopted the rules for the licensing of the continuum of care and assisted living facilities. So it actually took over a year for them to come up with the rules for assisted livings. Then in June of 2007, the rules were amended effective regarding plan of accommodation. So our residents have been living there for almost 10 years and they didn't want to move out and become their homes. And so they wanted to stay and age in place. But then the fire marshal came in and said, whoa, 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 your buildings are not like I-2 compliant, because most of them were converted residential care and they didn't have a lot of them didn't have sprinkler systems, or they didn't have what you needed to be like I-2 for some people that needed help in getting out of the buildings. And so that's when the laws were amended to address these state fire marshal occupancy codes and plans of accommodation for certain disabled residents. And so they were able to go ahead and, even though they may have been built like as an I-2 building, as an I-1, they were able to kind of be grandfathered in as an I-2 as long as they had certain requirements as the sprinklers, and then like in the attic and the fire doors and things like that. One of the things that they didn't have to do is, in nursing homes, you have the wide hallways to help get people out because they might be in hospital beds. And we don't need to have that because we don't have hospital beds in our buildings, so we're not having to, help them get out of hospital beds. So our hallways don't have to be as wide. So some of those buildings were grandfathered in like that. November 1st of 2011, that was a new one, and to us it seems still pretty new, but honestly it's going on 11 years, where the laws were amended that required assisted living administrators to become licensed by OSPELCA. And also that's the same year that residential care and the adult daycare administrators were also licensed underneath OSPELCA. Prior to that, the health department did the licensure for them. Actually, they were certificates. And then in 2013, we amended the laws as something that OKALA did, because prior to this, we did not have an informal dispute resolution. So when the surveyors came and they wrote you up, basically what you got was what you got, and you had nothing else to say. And so we did amend the laws to add that informal dispute resolution for assisted livings so that, we could say, hey, we don't agree with this, and we could go to that panel. And then in November 1st of 2016, we also addressed the scope and severity during surveys for assisted livings. So they weren't able to fine us under the residence right tags for unrelated deficient practices, because you guys are going to understand or know that everything can be tagged underneath the residence right. And so they like to do that. And then they'll tag the exact same occurrence under multiple tags. Well, if they come back and they clearly say one was a residence right, and it was because that they didn't get their medication, it wasn't in the building. But then, so they come back and they clear you for that one, but then they're going to tag you on another residence rights, maybe their laundry wasn't done. Those are two totally separate incidences, but it can still be tagged underneath that resident right. And I know I'm kind of doing a little extreme here, but then fines start, even though those are two totally separate practices. And so we were able to get this put in, so because we would never end our fines if they were going to continue, tagging that residence right. Then in November 1st, we did amend the law on OSPELCA. We asked for them to have the state standards to be the electronic testing. And one of the reasons why on this is with our administrator university is we had a lot of individuals that were coming from out of town and out of state. And we have a lot of regionals that might live out of state. And so they were wanting to do this, and it would be easier for them to go to the testing center and take the test there instead of driving or flying back. And so that was a nice thing for us to be able to take those state standards through the PSI, just like what you do your NAB. And then in November 1st of 2019, we also did an amendment that on the makeup of the board for OSPELCA, requiring administrators to have at least 3 years of experience. Some of the issues that were happening, especially whenever we went to the residential care and the adult daycare, we're seeing fewer and fewer administrators there. And so allowing at least 3 years of experience as an administrator versus the 5 years. Nursing homes still have the 5 years, but so that they could be on the board, and it would make appointments much easier for the OSPELCA board. And then we also put that it has to be in the facility type that they're going to represent so that they have that knowledge on the board and can be a better support for the board and for Z on what's going on in the buildings. Okay, so why the need for assisted living? Well, it's all about consumer choice. And so the care plans and the room settings can be adjusted to meet the needs and capabilities. So as people age, they might not have to move when they start to need more care assistance. And so it is about consumer choice. That's why if you've seen one assisted living, you've only seen one. So they're different. And so they have different choices. But also it allows them to age in place, and then when you've got your continued care community. So if they are at that assisted living and they're used to some of that staff, then they can easily go over to the nursing home and they're still going to see some of the same staff there. So it just makes that continuum so much easier for them. Also, it gives the provider a lot of flexibility. Again, so existing residential care and nursing facility providers, they were able to operate underneath their current licenses and step up with this new licensure type. And it just created another continuum of care in Oklahoma to adapt to what the residents were needing. Let's talk about some facts about assisted living. So all assisted livings are regulated at the state level. So each different state has different regulations when you go state to state to state. The crazy fact is that Minnesota actually just developed rules, regulations for assisted living. They were just kind of a free-for-all for a while. So that's kind of, I can't even wrap my brain around that, but that is the fact. And Oklahoma is one of the most regulated states for assisted living. Some people might think that's bad, but it's actually not so bad. We really want to take care of our seniors, and a lot of people look to us for some of the great regulations that we do have. Whenever I've gone up to our national affiliate is Argentum, and I have been able to go up to some fly-ins into Washington, D.C., and I've been able to use Oklahoma as examples for some legislation that they've been thinking about, especially the the national fingerprint background check. And so it's kind of nice to be able to brag about our state. We also are the only state that has the residential care like we have it. In most other states, residential care equals assisted living. So that's why whenever you're getting your OKALA license, which is a residential care assisted living, that's why it's kind of that way. That's why we have to educate our members about, when our students come to our class about that. There are other states that have something similar to what our residential care is called, but it's usually called something different. It's not regulated like how ours is done. And again, if you've seen one assisted living, you've only seen one. And memory care is not a separate license in Oklahoma. So memory care is part of your license, and that also is with your nursing home. So if you have a memory care unit, that's part of your licensure.
Steve?
Yes? You have a question? Okay. So what is the definition of assisted living? That means any home or establishment that offers or coordinates care to two or more persons that basically live there and are unrelated to the operator by choice or function. They need assistance with personal care, nursing supervision, may need intermittent or unscheduled nursing care. So that's kind of one of the when I should probably underline that. That's kind of the biggest thing is unscheduled nursing care, and may need medication assistance. That's probably really should be needs medication assistance. May need assistance with transfer and ambulation, and the intermittent nursing care and home health aides. Usually, a lot of that is provided by the intermittent nursing care is usually provided by a home health agency that comes in. So that's kind of one of the differences of what we have. So here's a few statistics about Oklahoma assisted livings. So I've got some comparisons from 2008 to 2022. So in 2008, there were 117 assisted living communities with 6,753 beds. In 2022, we're up to 189 with 14,122 beds. So you can see that we are the and you'll see later, I've got a comparison for the nursing homes. We're actually the fastest growing long-term care in Oklahoma. So that is an increase of 72 assisted livings and 7,369 licensed beds. One thing I want to educate you on is that in assisted living, even though we license beds as such, you might see a bed that when you see licensed beds, you might have like a 35 door or unit community, and they may license it as 50 beds. They're typically never going to have 50 patients or residents there. They just do that just in case, like husband and wives move in. So they're usually over licensing beds all the time. The average bed is a 59 bed community, and that's probably around like a 40 unit maybe. And largest is 166 bed. And then the smallest is a 5 bed. And those 5 beds, that's really becoming popular in other states. And that's where people are buying like a 3-bedroom home. And then they convert it to basically assisted living, and they license it for 5 beds. So that's that gives you an idea of that. So what kind of services and care do we provide in assisted living? So I'm kind of seeing on the screen because it seems like it's taking a while to catch up. But service and assisted living, we shall not care for any resident that needs care in excess of the level that we are licensed or capable of providing. So it's kind of a gray area. There's nothing black and white there. And so what that means is that we, when we do our application for assisted living, yes, our regulations give us kind of a guideline of the minimum that we can do, but then we can also say, for instance, that we may not, if someone becomes incontinent, we're not going to take care of incontinent people, or we're not going to take care of 2-person assist. And so that's part of our discharge criteria. So that's what our license says. Also, it says or capable of providing. So if we say we're going to provide care for individuals that are 2-person assist, you have to keep in mind, if that happens, then you have to have 2 staff members or that person in a case of an emergency, and then enough staff for everybody else in your community to get out of the building. So if you have 2-person assists, that means 4 people are assigned to those 2 people, and then enough for the rest of your building. So you may not be capable of getting enough staff in your building to take care of all those residents. So that's kind of where we're at on capable of providing. So you may end up having to discharge a resident just because you're not able to meet their needs or dignity just because of reasons like that. And then we also have to ensure routines of care, provision, and service delivery are directed by the resident to the maximum extent possible. So that resident should be part of that service care plan, should be telling us how they want things going. And that's pretty similar in your skilled and nursing. Okay, so to be admitted into assisted living, we don't receive orders like doctor's orders like you do in nursing homes. It's a little bit more difficult, but for our admission criteria, it has to be included for people that are wanting to be admitted. we have to have that in our personal care assistance, like our contract and our marketing materials have to say what the description is going to be, and then how we're going to have nursing supervision, intermittent or unscheduled nursing supervision, and then medication administration, and assistance with transfers or ambulation. So all of that is part of, we should include that description. So all it has to be is part of that based on services that we provide and how we're going to deal with that. And also our assistance with the cognitive, like with people with Alzheimer or dementia, how are we going to assist with that? So again, as I was saying before, all these services have to be put into your application for your licensure and in the resident service contract. And also basically assistance with that personal care, meals, housekeeping, nursing supervision during the nursing interventions, all of this information, kind of what we covered just before. And then plan programs for your socialization, activities, and exercise, and provisions for evacuation of the building, structure, and staff to meet the needs of the residents. I'll kind of put a little cartoon in here. I hope you guys enjoy it. But so assisted living residents, here's our little mission. So we don't admit any little whippersnappers. I love how our seniors call youngins whippersnappers. But so most assisted livings have a minimum age of at least 55 or older. So that's where some of the difference between assisted living and residential care might be. So prior to admission, this is what has to occur. You have to have a resident assessment and then a physician plan of care. So what that means is basically a physician fills out either the assessment form, or some companies have come up with a plan of care. And it's basically that prescription that tells us how to take care of them. In nursing homes, you receive orders. They're just faxed over to you. So that's kind of your physician plan of care. We have to get that done by the physician. And then after we get all that, then we have to have a contract signed. And then entrance fee and rent paid. So you guys usually just, unless they're private pay, but you usually are billing Medicare. So it's a lot harder to get people in our buildings. Now let's talk about our staffing requirements. So we're required to have a nurse, and what that means, that's an RN. So that's RN oversight, medication staff, an administrator, and then a dietary consultant, and that's only if we are providing specialized diets. So the qualifications, they do have to pass that national fingerprint background check, provide socialization. So if they're at activities, they have to be trained. And then on our specialized units, they have to be trained prior to. So those are like your memory cares. And our direct care staff have to be trained in first aid and CPR. And all staff has to have at least 1 hour of dementia training per year. And that's pretty much you guys and everybody. That was a fairly new law that went into place a few years back. So minimum staff requirements, again, another very, very gray area for us. It just says our adequate trained staff shall be on duty 24/7. So yes, we do not have staffing ratios. I can tell you one time I had, I don't know if it was a CNA or CMA, but they called our office and they were so upset for one of their friends who was working short staff all the time in assisted living. And they worked in a nursing home. And what they didn't understand is that we do not have staffing ratios. And so they felt like whoever the assisted living was understaffing because of that ratio. What they didn't realize was that this was a higher acuity community, and they really didn't need all these different staff And this was also on a night shift, so they really didn't need all that staff at night. And if you can have some one person staffing, and where you might see this would be like when we talked about that 5-bed last time, you might see that one person staffing at night. And that's going to be typically, they do need to be able to pass medications. And so you'll see that too. And the other thing is if you have staffing units that limit access, those staff, you have to have the staff in that access. They cannot be shared with, say, your assisted living staff. So you have to ensure that that staff is strictly for your Alzheimer dementia units. So here's some typical staffing in assisted living. So under your management, typically you're going to have an administrator, an activity director, a nurse, which we call a director of wellness. Used to you wouldn't see that, but now that acuity has risen, you will see them hiring like an LPN that is on duty, 40 hours a week, but also on call 24/7. A dietary supervisor. Sometimes you might have a marketing director and a maintenance director. Those aren't really given, but sometimes you have some of those. It just depends on how big the buildings are. At a minimum, on your direct care staff, you'll have an ACMA per shift, a CNA per shift, and a cook. Again, it just depends on how large the buildings are. And in our larger communities, here's some other people that are added: a business office manager, maybe housekeeping, laundry aide, a resident care coordinator, and that usually might be like an excuse me, an advanced CMA, and then some dietary aides added. As the administrator, you are a working administrator. You don't have assistants, you don't have, and you'll see here, we do not have MDS people, we don't have to do that. So our staffing is pretty skeletal, basically. We meet our needs as much as we can. So how much does assisted living cost? Because pretty much it's all private pay. So the average cost right now is about $3,900 in a private room. The financial assistance, here's some ways that you can get that, is if you have that long-term care insurance. VA aid and attendance can help as well. Tribal assistance, so in Oklahoma, some of the tribes, they do take care of their elders. That is, each tribe is separately different, so you would have to contact each tribe. The Advantage Waiver Program. And then also there's a thing called the Life Care Funding Group. And this is, they are people that will take like your life insurance, and basically they become the people that will get it when you pass away, and they'll kind of give you a little, I guess, a loan or whatever you say to help pay for your assisted living. So how is it figured? So you usually have a basic rate, a care rate, and then there's some additional fees. So the basic rate is based on a room style that you choose, and usually includes basic services. So we're going to go over those in a little bit. And then your care rate, there's usually different ways that people do them. You'll have a tiered service, which is all bundled, or an all-inclusive. And then sometimes you have like an a la carte. So we're only going to charge you for what you need. Additional service may include like room trays, and extra laundry, extra housekeeping, family meals, personal products. We do not provide toilet paper, and medication that is not covered by insurance, incontinence products. We do not provide any of those items, so all their toiletries. So basic services is that 24-hour staff to meet their scheduled and unscheduled needs, 3 meals a day and snacks in between meals, housekeeping in their private room, and then scheduled transportation, scheduled activities, emergency call system if it's in that contract, which most of them have them. Sorry guys, let me go back. And then basic amenities that you usually see in assisted living is you usually have a private or semi-private room, a private bath or semi-private bath, common living areas, dining rooms, activity room, laundry room, and then a barber shop. But usually the services are you contract with whoever's in there to pay for those services. Some other things, I mean, they're getting really fancy out there. They'll have like a spa bathroom, a theater room, which I have seen some of those, and they're really amazing. Private dining rooms, chapels, safe rooms, libraries, gym, exercise room, coffee bars and bistros, and game rooms, and even indoor swimming pools. So these assisted livings are really built for the seniors to really enjoy living there. Why do people move out of assisted livings? So one of the main reasons is if they should pass away. The other is acuity. Either it got too high or maybe they got better and they moved back home. Then financial. Sometimes they may have run out of money. Most of the time, like we say that, but if a resident has lived there for like 10 years and has, used up all their savings, a lot of times assisted livings will work some things out with them. They're dissatisfied. They may not be receiving the care services that they thought they were going to get, but they may also unhappy with staff. They don't like the food. They don't like other residents. Other residents can be really mean. Or there's no activity. So one of the things in assisted livings is like we're not required like nursing homes are, but maybe if the activities fail for a while, or you're in between activity directors, or they're not doing the activities they don't like, that may be some reasons. Location. A lot of times they may have moved into a place that was right close to where they lived, but yet their daughter lives across town, and then it's taking it harder for her to come see them. And so they may actually move closer to where a family member lives. So just before COVID hit, we would get like some top 10 state survey things. So keep in mind, these are kind of old, but I just wanted you to see some of the things that assisted livings have kind of get dinged for in surveys, just as a comparison. Some are staff qualifications, and this one is kind of a no-brainer. As administrator, you should never get dinged on this one, but the first aid CPR, and use of assessments, making sure that that assessment is developed for the care plan. Criminal history background check. For a while, right before COVID hit, there was a little trend that with the system, if you went in and say if you're rehiring someone, it would say that this is a duplicate. Do you want to continue? And then you might think, oh, I already did it. Maybe I don't need to continue. But your answer should always be yes, because you want to continue and get a new background check. So a lot of people are getting snagged on that one. But maintenance of records, they have to be organized and written with pen and ink. Residents' rights, as we've talked about. This one was free from abuse, neglect. Assessment timeframes. There was I guess some communities were having some really bad years, but they weren't getting these put in, or there were lack of nurses. And food storage and preparation is always on there. So if you don't get anything out of my presentation, there are several things that I want you to keep in your desk at all time. One is a Sharpie marker, because you need to make sure that you are labeling everything in that pantry, and those always walk away. So write this down, Sharpie marker. Extra hair nets, because for some reason when surveyors come, all the hair nets, no one can find one, it seems like. And then a food thermometer, because you need to ensure that those temps are being taken. And always, here's another hint for me, is trust but verify. And so, you know, walk that kitchen at the end of the day, make sure those temps were taken, make sure that the you know, everything's labeled, open up that refrigerator, make sure if any food's in there, it's dated, all of that good stuff, and you have your little Sharpie marker and, you know, mark away. And finally, the last thing for that food storage and prep that I want you guys to get out of this for me is if you are using those little test strips for your dishwasher, check the dates because they expire very, very quickly. And so you don't want to be caught with expiration dates on those. So check those because I've seen them both in assisted livings and nursing homes a lot of expiration dates on those. So I'm going to ask you at the end of this what I said, what you need to do in food storage. Okay, so care and services, that coordination of care, and that is with making sure that if they need to have home care or hospice services, medication staffing, they were really on a roll, and this is for you guys too, is you need to make sure that if you have staff that are administering medications that, oh, sorry, this is a different one, but our medications have to be reviewed monthly by a registered nurse and quarterly by a consultant pharmacist. So this is something that is different in assisted livings. But one of the things I wanted to point out is that they have been on a roll for a while, and that is ensuring that before your med aids, which most of the time you guys have nurses that get on med carts or do things, they make sure that they are signing off that they're capable of doing it, and also the yearly skills certification. That is something in nursing homes that you need to make sure that all of your CNA, CMAs are the yearly skills checklist is done. And number one, guess what that one is? That would be another resident's rights. And they have the right to receive appropriate medical care, be fully informed, and participate in planning of care and treatments. All right, so now here's some little statistics that you guys will probably enjoy. And this is assisted living versus nursing home. And so I've got them up here. So we're regulated at the state level. And so nursing homes have Title 19, which is your federal regulations. We mainly deal with residents a lot. A lot of times you mainly deal with families. We have more of a home-like environment. Nursing homes seem to be more institutional environment. However, some are really getting some good makeovers and looking better. Occasional skilled nursing, which you guys have the 24 licensed skilled nursing. We are primarily private pay, and nursing homes here have Medicare and Medicaid. We have a licensed nurse on call 24/7, but you have nurses on each shift. We have no required employee to resident ratio, which you do. No MDS, and you have MDSs. And then no certificate of need and no RN consultant. You do have that certificate of need. And your DON is usually an RN or equals your RN. Here's some more facts. It has to do with 2008, where we had the 117 licensed, and the nursing homes had 317. So 2022, this is at the beginning of the year, 189, and nursing homes had 282. So we had an increase of 72. Nursing homes had a decrease of 35 facilities. And so here's the bed averages. I'll just pop those up there. One thing to note, like whenever I was doing these numbers, that it does not include any of the VA nursing homes or the homes for intellectuals with, or the homes with intellectual disabilities that are in there. So another little thing, that this is actually the first year that I've put this in here, but just this is a senior living impact across the United States. And so when we, our national affiliate Argentum, when we're talking about senior living, we're talking about like even though it's independent living, assisted living, the residential care, senior living, this is the impact that we have across the United States in economic impact, government revenue, the jobs directly supported, indirectly, and social responsibility. So we have a really, really good impact. The states that are in blue actually means we have really good senators that are in both in Washington, D.C., as well as our senators and legislators in Oklahoma that really support our senior living as well as nursing homes and try to help with anything that we, when we get a hold of them, we have some people that are really helpful. Here's Oklahoma's impact directly. And so if you look at this, that our economic impact is 602.4 million. And our jobs that we directly support are 2.7. And that is people that we employ directly for our senior living communities. And then jobs that are indirectly, that is 1.9. And then, so anyway, so these are really kind of some fun little statistics to see. Here is another really cool graphic that I thought was really neat. So if you look at Oklahoma and senior living as a whole, and you compare them to other big, big, I don't know, pharmacies or comparisons with other industries, you'll see that, I'm going to move this little box so I can look a bit better. So you'll see that Oklahoma alone, we're 612.4 million, our total impact. And so one of the things that is higher than us, those are hotels and motels that have a 996.1 million. We are higher than pharmaceutical manufacturing and child day care centers. But colleges and universities are higher than us at 716.8 million. But if you look at the senior living across the United States, which we're at 246.9 billion impact, the pharmaceutical manufacturing is higher there, but air transportation, auto manufacturing, and hotels and motels are all less than us across the United States. So senior living has a huge economic impact. And I don't think our legislators and other people realize that, and that's something that we need to keep letting them understand, especially whenever it comes to some of the relief funds and things that they're trying to get out there for people. Here's an impact too on how COVID has impacted senior living, specifically our assisted livings with our senior living providers in Oklahoma, how many seniors we serve. And this was conducted off of mainly our residential care and our assisted livings. This data came from what I provided on that, and the number of facilities and the number of facilities operating at a loss. So you see how bad that is. And the jobs supported and our impact. So we, the provider relief allocated and uncompensated losses. So assisted living and residential care, you'll see how much we got a little 2% to our 98% of our losses, whereas nursing homes, they got a lot of money. And so they got so much relief in whether it was the PPE, whether it was money for different things, assisted livings and residential care, while we had to still do the same guidelines like what the health department wanted us to do, that was all out of pocket for us. We never received any funds for this. So it's been pretty devastating on our industry. And so here's some other impacts if you'll see how the number of seniors and how much this loss has been. So basically about 16,381 per resident in Oklahoma. It's pretty bad. And it's still happening, so. All right, so this is kind of towards the end of my presentation, and I would love for you to join us March 15th for our assisted living day at the Capitol. It's a come and go. And when you sign up, we'll give you some additional details, but we do have a little survey monkey there that you can sign up for. And you don't have to be a member or anything. It's assisted living day. And we invite everybody to come and help us celebrate the birthday of assisted living. Any questions? I am going to quiz you guys on what you learned. Okay,
You're
everyone
awful
wake up.
quiet. Nobody has questions.
I know. Everyone wake up. See, I know how you feel now. Questions?